Mai, great to have you on board. Thanks for joining today. Could you tell our audience a little bit about yourself?
Hi, I'm Mai. I'm based out of Cairo. I do cover Egypt and Levant. I work at Organon, which is a women's health company. I focus on women's health policy in both Egypt, Jordan, and Lebanon, to be specific. And what that means is that we work with government stakeholders to advance women's health issues. We try to implement public policy strategic plans. I also focus on ESG activities in Egypt and Levant.
That's fantastic. And talk about that. We obviously, we know about what's happening in women's health. We know how big a deal it is these days. Talk a little bit about what you're seeing in terms of some of the women's health technologies and some of the technologies that are improving women's health in the Levant region that you work in.
So there's a lot coming out of the Middle East, and in Organon specifically, we chose to focus on women femtech. We started last year with a femtech accelerator program, and we provided expertise, camps, knowledge, and skill support to empower women. We received more than around 300 applications, and there were 3 women-led winners from the UAE, Lebanon, and Cyprus. What's interesting, they're tackling different issues, and the winners have been tackling different issues where we had the top women, our top women winner being Gyno, and they were a startup. They were focusing on or redesigning the gynecological experience. They identified the causes behind gaps in testing for the potentially cancer-causing HPV virus. And so they were trying to work on a user-centered platform offering home testing and telehealth. So we were very happy with that. The launch was in Cairo, and we're continuing with that hopefully this year as well. So there's a lot going on in that arena in our area of the world.
Yeah, it certainly sounds like it. And when you're looking at that area and you're looking at where these sorts of efforts are taking place, where do you hold the most hope? Which area of women's health tech do you see making the biggest difference today, where you see it making a big difference tomorrow?
You know, there's so much to be done. I mean, specifically in Egypt, for example, where we're a very populated country, and we're forecast to become one of the most populated countries in the world. So any efforts are, of course, welcome, but it's important to understand that from a very young age, women need all the support possible. So any femtech intervention is important. Mental health, for example, we saw that one of the winners of last year as well, Sira, was Lebanese mental health company, and their focus was on creating a safe platform for women to come to roundtable discussions online and give support to each other, and to have free access to mental health support. So that's one of the areas that's up and coming, mental health. The woman is the nucleus of the family, and we are very focused on her well-being in general, but that was one of the areas that we're seeing as, very important. And with specifically seeing there's underinvestment in general in women health, in women companies, women-led companies in the region. But that's a specific area. I think that's important to focus on and support.
Yeah, absolutely. And what are some of the areas where you see some need for improvement from your standpoint?
Need for improvement. So basically, again, with the population, there's a lot to be done. Egypt specifically, it's nice to be in this part of the world right now because there is a focus on women. There is a recognition on the importance of the female. You have a campaign that's under the patronage of the president, focusing on women, and it's called 100 Million Health. And it's nice to see that it's shed in a positive light. It's not called 100 million disease, it's called 100 million health. The efforts are tremendous. I mean, just in a couple of decades, where you went from something like early breast detection not being there, you have NGOs just focusing on that, and millions of pounds going towards that, eradication of Hep C, lots of efforts towards family planning and awareness raising regarding that. As a company, we are here for her help, and we are really that. We're trying to partner with the different stakeholders on the ground because we do recognize the importance of partnering with these initiatives. You can't do it alone. So with us, the government, the UN, international organizations, because a lot needs to be done in that area, but a lot has been done.
That sounds like it. It sounds like there's a lot of good progress coming. And again, I think one of the things we have in the community that's joining us here today is this amazing group of people who are passionate about healthcare and passionate about women's health, obviously, given the HITLAB Women's Health Tech Initiative and the network there. And what kind of organizations are existing in Egypt and the Levant region, Eastern Mediterranean countries that are helping support women's health tech and women's health in general?
So with women's health tech, it's important to note that there's we're enabling with digital literacy. More and more women are becoming, and the data supports that more and more women are becoming digitally literate. And that's important because you can't reach women, you can't, if they're not, able to, if they're not there. Just to note the importance of where we are now, we were talking about things like FGM laws, for example, in Egypt, where you couldn't think of them before, but now they're there. We're tackling an issue that needs a paradigm shift. And with that, we need to reach the women. You need to be able to not just have face-to-face interaction. Virtual awareness raising is super important in this area of the world. We have projects where we were declaring, for example, entire villages FGM free. And on the day of the declaration of an entire village being FGM free, you hear someone in the background saying, do you think the woman presenting right now didn't get FGM for her daughter? That's not the case now. You're able to reach a woman on her phone, talk to her, enable her voice where she has her own power. Even with family planning, even though it's her body, it's a family decision. The contraception method that she uses is not her choice. She would go back to her family. Now you're able to reach more and more the woman, and she's empowered to make her own decision.
That's fantastic. Well, this has absolutely been wonderful, and really appreciate all the different resources and all the different topics that you're bringing in from this perspective of women's health in Egypt and the Levant region. So thank you very much for that, Mai, and best of luck to you. Looking forward to staying in touch. Please come back to join us again soon.
I will. Thank you. Bye.